Are your ankles looking puffier than usual? Do your legs feel heavy and uncomfortable by the end of the day? If you're over 60 and dealing with swollen legs, the culprit might be hiding right in your refrigerator. 3 common vegetables that you probably consider healthy could actually be making your legs swelling worse. First, let's understand what's happening when your legs swell. The medical term for this is edema, which occurs when excess fluid builds up in your tissues. For seniors, this is particularly common because our circulation naturally changes as we age, and our bodies may become less efficient at moving fluids back toward the heart. In the next few minutes, you'll discover 3 specific vegetables that can contribute to leg swelling, understand exactly why this happens, and learn simple alternatives that can help reduce that uncomfortable puffiness. Before we start, consider subscribing to the channel. Now, let's dive in. Number 1. Canned tomatoes. Let's start with our first vegetable that might surprise you: canned tomatoes. Now you might be thinking, wait, tomatoes are supposed to be healthy, right? And you're absolutely correct. Fresh tomatoes are fantastic for you, but here's where things get tricky with the canned versions. Most canned tomatoes contain significantly more sodium than you might realize. A single cup of canned tomatoes can contain anywhere from 400 to 1200 milligrams of sodium, depending on the brand and preparation method. That's already a substantial portion of the recommended daily limit for seniors, which is around 1500 milligrams. Here's what happens in your body when you consume too much sodium. Your kidneys work to maintain a delicate balance of fluids. When sodium levels spike, your body retains extra water to dilute that sodium. This excess fluid has to go somewhere, and gravity pulls it down to your lower extremities. Your legs, ankles, and feet become the storage tanks for this extra fluid. For seniors, this process becomes even more challenging. As we age, our kidney function naturally declines, making it harder to process and eliminate excess sodium efficiently. Additionally, circulation tends to slow down, making it more difficult for that retained fluid to move back up through your system. Does this mean you have to give up tomatoes entirely? Absolutely not. Here's what you can do instead. First, choose fresh tomatoes whenever possible. They're naturally low in sodium and provide all the beneficial nutrients like lycopene and vitamin C without the added salt. Better alternatives for getting similar nutrients include fresh bell peppers, which provide vitamin C without the sodium load, or fresh cucumber, which actually has natural diuretic properties that can help reduce swelling. Another great option is to make your own tomato sauce in batches. You can control exactly how much salt goes in, and you can freeze portions for future use. When you do use canned tomatoes, try rinsing them in a colander before adding them to your recipes. This simple step can remove up to 30% of the added sodium. When shopping, if you must use canned tomatoes, look for no salt added varieties and rinse them before use if possible. This simple step can reduce the sodium content by up to 40%. Your legs will thank you for making this small but significant change. Number 2. Pickled vegetables. Our second vegetable category might be even more surprising: pickled vegetables. This includes pickled cucumbers, pickled beets, pickled carrots, sauerkraut, and any other vegetable that's been preserved in a vinegar and salt solution. The pickling process requires substantial amounts of salt to preserve the vegetables and create that tangy flavor we love. A single medium pickle can contain over 800 milligrams of sodium. That's more than half the recommended daily intake for seniors in just one small vegetable. Pickled vegetables create a double problem for leg swelling. First, there's the immediate sodium load that causes fluid retention, but there's also a secondary effect that many people don't realize. The high acid content in pickled foods can affect your body's pH balance, which in turn can impact how efficiently your circulatory system functions. When your body becomes too acidic, it can lead to inflammation in your blood vessels. This inflammation makes it even harder for fluid to circulate properly, creating a perfect storm for leg swelling. The combination of excess sodium and reduced circulation efficiency can leave you feeling uncomfortable and swollen for hours or even days after eating these foods. The good news is you don't have to eliminate that satisfying crunch and tangy flavor from your diet. There are several smart alternatives that can give you similar satisfaction without the sodium overload. Try making quick pickles at home using much less salt. You can create delicious pickled vegetables using mostly vinegar, a small amount of salt, and natural flavor enhancers like herbs and spices. The result is still tangy and crunchy but with less sodium. Fresh vegetables with herb-based dips can also satisfy that craving for something zesty. Think cucumber slices with a yogurt-based herb dip, or fresh bell pepper strips with a low-sodium salsa. If you absolutely must have traditional pickles, look for low-sodium versions and limit your portion size. Also, try to balance them with potassium-rich foods like bananas or oranges, which can help your body process sodium more effectively. Number 3. Canned corn. The third vegetable that can significantly worsen leg swelling in seniors is canned corn. While fresh corn can be part of a healthy diet, canned corn presents multiple problems that make it particularly troublesome for anyone dealing with circulation issues and fluid retention. Regular canned corn typically contains between 270 to 400 milligrams of sodium per cup, depending on the brand and preparation method. This sodium comes from the preservation process and added salt used to enhance flavor during canning. Many seniors choose canned corn because it's convenient, affordable, and seems like a healthy vegetable option, but they're unknowingly consuming significant amounts of sodium with every serving. The situation becomes worse with cream-style corn, which can contain over 700 milligrams of sodium per cup due to the additional processing and thickening agents used. Frozen corn with added seasonings or butter sauces can also be problematic, often containing 300 to 500 milligrams of sodium per serving. But sodium isn't the only concern with canned corn. The canning process also concentrates the natural sugars in corn, creating a food that can cause blood sugar spikes followed by inflammatory responses throughout your body. When your blood vessels are dealing with inflammation, they become less efficient at moving fluid properly, contributing to stagnant swelling in your legs. Canned corn also often contains added preservatives and stabilizers that some seniors find inflammatory. These additives can trigger immune responses that affect circulation and worsen existing swelling patterns. Many seniors eat canned corn multiple times per week because it's easy to prepare and seems nutritious. However, the cumulative effect of regularly consuming this high-sodium, high-sugar vegetable can significantly impact fluid retention, especially when combined with other processed foods throughout the day. The natural sugars in canned corn can also contribute to advanced glycation end products in your bloodstream, which damage blood vessel walls over time and make circulation problems progressively worse. If you enjoy corn, fresh corn on the cob or frozen corn without added seasonings are much better options. Fresh corn provides the same nutrients and fiber without the excessive sodium load. You can also try alternatives like fresh peas or green beans, which provide similar texture and sweetness without the problematic sodium content. Beyond avoiding these 3 high-sodium vegetable categories, there are several other dietary strategies that can help manage leg swelling effectively. Focus on potassium-rich foods, which help balance sodium in your system. Bananas, oranges, spinach, and sweet potatoes are excellent choices. Fatty fish like salmon, then walnuts, berries, and leafy greens can help reduce the inflammation that contributes to poor circulation and swelling. It's important to note that persistent leg swelling can sometimes indicate underlying health conditions that require medical attention. If you experience sudden onset swelling, swelling in only one leg, or swelling accompanied by shortness of breath or chest pain, please consult your healthcare provider immediately. Remember, small changes can make a big difference. Start with one swap at a time. Maybe this week, try fresh tomatoes instead of canned, or make your own herb seasoning for frozen vegetables. These simple adjustments can help reduce uncomfortable swelling while still keeping your meals delicious and satisfying. This video is intended for informational and educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. If you experience any symptoms, discomfort, or health concerns, please consult your doctor or a qualified healthcare provider. Always talk to your doctor before making any changes to your diet, supplements, or lifestyle. If this video has been helpful, please give it a like and subscribe to our channel for more senior health tips. Thank you for watching, And I look forward to seeing you in our next video, where we'll continue exploring practical strategies for staying healthy, comfortable, and active throughout your golden years.